Pneumonia, diarrhea, malaria, measles, neonatal conditions, HIV and malnutrition cause more than 70% of the deaths in children under 5 years of age. The Integrated Management of Childhood Illness, or IMCI, strategy is a feasible and effective way to prevent most of those deaths. This strategy provides guidelines for health workers in clinics to use in the care of sick children. The guidelines were developed by WHO and UNICEF using scientific evidence and technical updates. They describe management of common childhood illnesses in a set of integrated or combined guidelines instead of separate guidelines for each illness. A health worker can determine if a child is severely ill and needs urgent referral by following the integrated case management process to quickly consider all of a child's symptoms and not overlook any problems. If not seriously ill, the health worker can follow the guidelines to treat the child's illnesses. If a family waits to bring a child to a clinic until the child is extremely sick or takes the child to an untrained provider, the child is more likely to die from the illness. Therefore, teaching families when to seek care for a sick child is an important part of the case management process. The case management process is presented on a series of charts in both French and English. These charts describe the following steps: assess the child or young infant, classify the illness, identify treatment, treat the child, counsel the mother, give follow-up care. The step called assess the child means taking a history and doing a physical examination. Classify the illness means making a decision on the severity of the illness. A health worker will select a category or classification for each of the child's major symptoms, which corresponds to the severity of the disease. Classifications are not specific disease diagnoses. Instead, they are categories that are used to determine treatment. The charts recommend appropriate treatment for each classification. When using this process, selecting a classification on the chart is sufficient to allow health workers to identify appropriate treatment for a child. For example, a child with the classification very severe febrile disease could have meningitis, severe malaria, or septicemia. The treatments listed for very severe febrile disease will be appropriate because they have been chosen to cover the most important diseases included in this classification. Treat means giving treatment in the clinic, prescribing drugs or other treatments to be given at home, and also teaching the mother how to carry out the treatments. Counsel the mother includes assessing how the child is fed and telling her about the foods and fluids to give the child, and when to bring the child back to the clinic. The case management process for sick children aged 2 months to 5 years is presented on 3 charts titled Assess and Classify the Sick Child, Treat the Child, Counsel the Mother. Management of the young infant aged up to 2 months is somewhat different from older infants and children. It is described on a different chart titled Assess, Classify and Treat the Sick Young Infant. The IMCI charts are designed to teach the case management process to health workers at the primary care facilities who see sick children and infants. It is a case management process for a first-level facility such as a clinic, a health centre, or an outpatient department of a hospital. When dealing with a mother or caregiver, make them feel comfortable and at ease. Use good communication skills when talking to the mother. When a mother brings a child because the child is sick due to illness, not trauma, and the child is sent to a health worker assigned to manage the children in the clinic, the health worker needs to know the age of the child in order to select the appropriate chart and begin the assessment process. If the child is aged 2 months up to 5 years, select the chart Assess and Classify the Sick Child aged 2 months up to 5 years. Up to 5 years means the child has not yet had his 5th birthday. If the child is not yet 2 months of age, the child is considered a young infant. Use the chart Assess, Classify and Treat the Sick Young Infant. A mother or other family member, such as the father, grandmother, sister, or brother, usually brings a child to the clinic because the child is sick. But mothers also bring children for well child visits, immunisation sessions, and for treatment of injuries. The steps on the Assess and Classify chart describe what the health worker should do when a mother brings her child to the clinic because he is sick. The chart should not be used for a well child brought to immunisation or for a child with an injury or burn. When patients arrive at most clinics, clinic staff identify the reason for the child's visit. Clinic staff obtain the child's weight and temperature and record them on a patient chart, another written record, or a small piece of paper. Then the mother and child see the health worker. The health worker uses a recording form to write the details of the child, the assessment plan, and so on. If the health worker only assesses the child for one particular problem or symptom the mother is concerned with, he might overlook other signs of disease. The child might have pneumonia, diarrhea, malaria, measles, or malnutrition. These diseases can cause death or disability in young children if they are not treated. The chart Assess and Classify a sick child aged 2 months up to 5 years describes how to assess and classify sick children so that signs of disease are not overlooked. According to the chart, the health worker asks the mother about the child's problem and checks the child for general danger signs. A general danger sign is present if the child is not able to drink or breastfeed, or vomits everything, or has had convulsions, or is lethargic or unconscious, or is convulsing now. Then the health worker asks about the 4 main symptoms: cough or difficult breathing, diarrhea, fever, and ear problems. A child who has one or more of the main symptoms could have serious illness. When a main symptom is present, the health worker asks additional questions to help clarify the illness. The health worker checks the child for malnutrition and anemia. The child's immunisation status, vitamin A supplementation, and deworming status are checked, and other problems mentioned by the mother are assessed. A child with a general danger sign has a serious problem. Most of these children need urgent referral to hospital. A child has the sign not able to drink or breastfeed if the child is not able to suck or swallow when offered a drink or breast milk. A child with a general danger sign may need life-saving treatment with injectable antibiotics, oxygen, or other treatments which may not be available in a clinic. The health worker must complete the rest of the assessment immediately, provide an appropriate pre-referral treatment, and refer the child urgently to hospital. A child who is not able to hold anything down at all has the sign vomits everything. A child who vomits everything will not be able to hold down food, fluids, or oral drugs. A child who vomits several times but can hold down some fluids does not have this general danger sign. During a convulsion, the child's arms and legs stiffen because the muscles are contracting. The child may lose consciousness or not be able to respond to spoken directions. Convulsions may be associated with meningitis, cerebral malaria, or other life-threatening conditions. All children who have a convulsion during the present illness should be considered seriously ill. The health worker asks the mother if the child has had convulsions during the current illness. The health workers should use words the mother understands. For example, the mother may know convulsions as fits or spasms. A lethargic child is not awake and alert when he should be. He is drowsy and does not show interest in what is happening around him. Often, the lethargic child does not look at his mother or watch their health worker's face when he talks. The child may stare blankly and appear not to notice what's going on around him. An unconscious child cannot be wakened. He does not respond when he's touched, shaken, or spoken to. This has been an introduction to the IMCI process and how we use the charts to manage our patients. In the following chapters, we'll look at more specific signs and symptoms and what a health worker should do about them.